out there for me, it would definitely be that of a veterinary technician, especially one that works in emergency medicine. A veterinary technician's duties that are performed on a daily basis, and some of the most important, are the preliminary physical examinations of the patient, as well as getting a complete medical history on the patient. This helps the doctor begin their diagnosis process and what tests they would like to perform on the patient. Some other duties that a veterinary technician performs is caring for hospitalized patients, such as monitoring fluids as well as administering medication around the clock. Other duties that entails is radiology, as well as performing laboratory procedures such as blood work, fecal analysis, and urine analysis. Veterinary technicians don't just have to work at an animal hospital. They can also work at certain shelters and humane societies, veterinary supply companies, diagnostic laboratories, and some veterinary technicians even work at zoo and wildlife centers. Now, to become a certified veterinary technician, one must attend a 2- or 3-year AVMA accredited veterinary technology program. After earning the associate's degree in the technology program, they then must take their state board exam in the state in which they live so they can license to practice. And in this state board exam, there's a written portion, a practical portion, as well as an oral portion. Currently, there are 40 states and provinces that certify, register licensed technicians. Working at a veterinary clinic is the most rewarding job that I have ever had. I've worked at a daytime clinic for 4 years before a brand new animal emergency clinic opened, where I jumped on the opportunity, and I've been there for a year now. Now, the daytime veterinary clinic and the emergency veterinary clinic are completely different, and I don't just mean by the hours of night and day. The daytime veterinary clinic usually, for the most part, sees routine procedures such as vaccinations and spaying and neutering of patients. On the other hand, at the emergency clinic, usually by the time the patient gets to you, they're in critical condition, so you must always be thinking fast, and time is vital. Whether it's working at a small animal practice, a large animal practice, or even working at a shelter, as long as you're helping animals, it's rewarding in my eyes to get them happy and healthy again. Working at a veterinary clinic allows me to achieve my education goals. Since I am taking online classes to be a veterinary technician, it is required that I work at an approved veterinary hospital. This works out very well because the doctors are always quizzing me on different things and asking me questions for once and seeing if I know the answer. And if I don't, they will explain it to me just as if I were in a classroom and they were my teacher. A lot of the emergencies that come into the clinic are some that I've read in my book as well, which helps me better assist the doctor, the patient, and as well as the family. Seeing a variety of problems that animals have that come into the clinic can be difficult, especially when they're not able to talk to us and tell us what is the problem. For example, we had a 2-year-old female Great Dane come into the clinic with vomiting and diarrhea and not able to walk. Now, you can imagine a Great Dane is a fairly large dog, about 200 pounds. So it's very hard when this dog is not able to walk. It's not like a 5-pound Chihuahua that you can just carry around easily. So after all the tests were run, radiographs, blood work, etc., all the results appeared normal. The doctors, as well as the staff and the family, were all baffled as to what it could be. So the doctors decided to keep the Great Dane for a couple of days on IV catheter and fluids, as well as administering medication around the clock to see if this would help get her better. Well, within a couple of days, the Great Dane was perfectly back to normal, walking and wagging her tail and ready to go home as if nothing had ever happened. We may never know what the cause of this was. On the other hand, have the cases that come to the emergency clinic that you know exactly what the problem is, such as if a cat or dog gets hit by a car, or if you have, a patient that has gotten into a dog fight, whether it's with another dog or a cat that's been attacked by a dog. You pretty much know what the problem is, and you just have to take care of them in that aspect. On the other hand, you have the pet that there is no treatment for, and it's a very sad case, and the only way that you can help them and make them feel better is to ease their pain.